for us to ensure that the model is trained appropriately, it's a consensus process. For every answer, at least we need 3 evaluations by the experts so that they are looking at the content and saying, this aligns to the Kenyan guidelines or this does not. This is what we used to do, but not anymore. That way, we are nudging the model towards the context of practice of healthcare as it is right now. And you're going to see a demo further down after my presentation. So one other thing that we've been able to do, so we have enrolled non-research participants. It's just the same way like you've seen a demo of somebody using ChatGPT. So we've invited volunteers to challenge the model in a volunteer basis. And they were, for example, the University of Nairobi team have asked over 300 questions. And you see, they're aligning the model towards their context. They're virtually almost to get to 100%. The good thing about aligning a model to your context, it's now ready for further training and testing in a healthcare context. For example, we hope after a model is trained to have a silent trial. A silent trial is whereby the healthcare professional is going to use the clinical chatbot, but the decisions or what the chatbot proposes is hidden to them, so they still have to make their expert decision. But we'll retrospectively look at potentially missed opportunities, where they converge or where there is some divergence, so that we see, is the model really talking to actual healthcare? After that phase, in the future, you're going to also have a randomized controlled trial, the gold standard of testing something in healthcare, where you have an intervention and a control group, and you now compare outcomes. The people who used the AI tool, did they have better health outcomes? And can those outcomes be associated with the use of the technology? That's where we are ending at, but we're still training and validating the model. So we have KNH and UN. We also have another group, which is the adolescent and child health group, because we have identified that healthcare, if it's well taken care of at childhood, then people are healthy as they're adults, right? So that's why we are really concentrating in that space. And we are looking at a number of areas. So we're looking at HIV, reproductive health, mental health, nutrition health, and type 1 diabetes. And to ensure that the process is consensus-driven, we have held a number of workshops, talking to experts, trying to understand what they need, what they expect, what their fears are, and how we can meet in the middle. My last slide is my contact, my LinkedIn account. This study is funded by Science for Africa, so I'd like to acknowledge that. It's a seed fund to do a proof of concept study that ultimately now takes us to a new level of now evaluating and looking at how the technology works potentially at a frontline healthcare context. I'll stop there with the presentation and invite my colleague to walk you through a demo. So the demo is a real web-based application. Please welcome Paul.